Hello, I'm Dr. Megan Aston. I'm a professor in the School of Nursing at Dalhousie University in Halifax, Nova Scotia. I want to thank you for having me today to talk to you about feminist poststructuralism and how I've used that in my research, in my teaching, and also in clinical practice. I'm going to share my screen with you to get us started. Great. So I'm going to give some examples regarding two of my studies. One is with children with intellectual disabilities. The other is from perinatal nursing that I have done my whole career. I would like to begin with a land acknowledgement, and I am in Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq people, who have been here for over 11,000 years, and that we are part of the treaties of peace and friendship, and we're all treaty people here. Also, to acknowledge the histories, contributions, and legacies of the African Nova Scotian people and communities who have been here for over 400 years. I'll begin with a little bit of history regarding feminist theory. Originally, it was primarily a white heterosexual women's movement in North America, certainly a global movement, but the dominant way of looking at feminism was through a construction of sexism. What has happened over the decades is there's been first wave, second wave, third wave. You might have read about that, and how feminism has changed, and it's still changing. And when I came to learn about feminist theory in the 90s, there had certainly been some changes at that time. And to make sure that there was more inclusivity and intersection. So a number of scholars, Black scholars, 2S LGBTQ scholars, quite a number, enabled a different lens or focus to ensure that feminism was being mindful in the theories and concepts to focus not only on sexuality, but also gender, race, abilities, all of those people, positions. And I will get into that a little bit more to talk about subjectivity, positionality, and how that's really important to think about when contextualizing and using theory. So just to keep this in mind, poststructuralism. So these are the key concepts. I'm just going to mention them now so that you can continue to think about them as I weave the conversation and talk about each of these in detail. The two theorists or scholars that I use in my research are Foucault and Derrida, two founding scholars that I have found very useful, and I can understand what they're saying in terms of their concepts. So with postmodernism or poststructuralism, it's a worldview, and there's a social construction. So needing to go beyond the body, beyond the individual, but how are we all socially constructed? Relations of power, talking about that. How is power understood historically, presently? How is it negotiated? Multiple truths. A lot of qualitative studies use multiple truths, but poststructuralism uses multiple truths in a particular way. I will be talking about that. Discourse analysis. So Derrida really pushed this thinking a bit further and looking at different worldviews and the way we understand certain practices. Meaning, again, looking at individual understandings, social understandings of different practices. So think about practices in nursing, and I'll talk more about that too. Beliefs, values, and practices is a starting place to really listen to the stories that people are telling us, or if we're reading texts, what language do they use to describe social beliefs and values or personal? And finally, subjectivity and agency. And again, that's talking about people's positionality. So if you think about participants in your study, who are they? And agency comes back to how people use power. So you can see that there are connections between all of these. And I'm going to get into that to demonstrate some of the complexities. So Chris Whedon wrote this book, and I have used it, well, since the 90s, and really appreciate what Chris has written. I consider her a rock star of the feminist post-structural world. And Chris is from the UK. The book is easy, I find, to read. It's very accessible and explains all these concepts, bringing together feminism and post-structuralism. There are certainly other scholars besides Chris Whedon who have began, I believe, as feminist focused and then looking to post-structuralism and how there are some commonalities, but how does each worldview strengthen the other? So they come together in, I think, a very constructive and critical way. So the lived experience, feminism is always focused on that in general, to talk about, well, in the beginning, women's experiences and not needing to look to science, look to other ways to triangulate, to try and understand someone's or a woman's story or their experience. What the person says is the truth. So the lived experience is important, certainly in feminism and post-structuralism. Also, both look at the social construction. So even though we're starting with personal stories, how do you understand them? How do you contextualize those within a social discourse, but also within institutional discourses? And I'll be talking a lot about the hospital discourse, the language of health and medicine, and how certain beliefs and values are constructed. The personal is political, love that. Again, nothing is neutral, but everything is political. Empowerment, again, another way to look at power. Both use that term in a particular way. Social justice is always there. Now, Foucault has been faulted on not being political enough, but the foundation is there. And then feminism really pushing that justice, social justice agenda. Butler and Scott are two other scholars who I have enjoyed reading and incorporating ideas from. Butler, even today, you can watch videos, and she is very theoretical. So sometimes it's a bit difficult to understand for some people, but brilliant, brilliant scholar. And just recently, Dr. Julianne Cheek and myself, we just published a book. It's an easy read, I think, to begin to understand postmodern and post-structural approaches. So we really want it to be accessible to as many people as possible, students and faculty, frontline workers. So it is a research methodology, but I believe it is also a way to look at the world, a way to understand our own positions, not just as researchers, as people, but who we are and how we interact in the world. So using a theory, I always use this in all my research because I do believe it can answer a lot of questions that are political, issues of marginalization, issues that need a critique, a critical theory, social justice. So some of these phrases I've picked up, and always believing that the everyday world is problematic. So I think about ontological, epistemological foci. So what do you believe the world is? Where does knowledge come from? How is it constructed? How do I fit in as a researcher? So I love these phrases. So if you think there's problematic constructions out there, yes, that's what I believe. What's normal? So it seems like a simple phrase, but it's the normalization. So what are the dominant discourses, the ways of being in the world? So yes, I and many other people believe that we are in a white, patriarchal, heterosexual, those are just three dominant ways of being in the world, certainly in North America, but we see the effects globally with colonization, for example. So what's normal? So always questioning that and looking beyond. So questioning that status quo and just thinking, well, we just can't take things for granted. We need to move beyond and see where are the other voices, where are the other ways of practicing in the world. So, discourse analysis, it is a frame or a way of bringing many of the concepts together. So as I've already mentioned, beliefs, values, and practices. What are the beliefs and values of individuals, but also society, different cultures, different race, different abilities. We begin with that because that lived experience comes from somewhere that is positioned within social and institutional discourses. And how this all comes out is through relations of power. Okay, so I know that's sounding a little bit abstract, but just hang on, bear with me. I will come to an example. So trying to put this in a model is difficult because it is a lot of complex thinking, pulling these ideas together. And if you love theory, if you love that fun, abstract way of thinking, then it will push the limits that way. It moves us from linear ways of thinking into a different way of thinking. So you can see the two circles, beliefs, values, and practices within both. I'm going to start with a breastfeeding example to talk about how discourse affects breastfeeding. So, number one, if we think about the meaning of breastfeeding from a healthcare medical point of view, I want you to think, what are some of the words or meanings that come into play about breastfeeding? Let's say from a nursing perspective, healthcare perspective. So perhaps antibodies. The baby will have great nutrition, the proper nutrition, the strengthening of the jaw, prevention of diabetes, prevention of obesity. The list goes on and on and on about the physical benefits. Also, that attachment and bonding, the breastfeeding helps with that, the warmth of the baby. So from a healthcare point of view, there's a lot of pressure to say this discourse is the most important. All mothers, people need to breastfeed, chest feed. Again, we need to think of the language. What is the meaning? What is the meaning of breastfeeding? So again, that can be limiting too. How do we open that up? But I'm just focusing on breastfeeding right now because there are other ways to think about it, which I will get to in just a moment. So that's one discourse in the socially, well, let's say the institutionally constructed way of health. So then we think about breastfeeding in public. So then think about the images, think about what happens, think about the practices of a person breastfeeding, chest feeding in public, in the park. Oftentimes, and we've seen this in the news, someone, perhaps a police officer, will come and ask the person to leave or cover up. Why? So we need to think about the meaning of breasts. In this social context, the social discourse is that breasts are sexual, and some people feel uncomfortable. They think that it should be hidden. People's sexuality needs to be behind closed doors. So the meaning really is important to focus on. So those are the social beliefs and values. Individuals might also agree with that and take that up, but not everyone. So what is the practice? So that person sitting there being asked to cover up might cover up because feeling there's some oppression and judgment coming from that people and other people, that it affects their practice. Or they might choose to say, no, I have the right, and actually legally it is okay to bare your breast in public, that they push back. And that would be the way that they would use their power. So you can see that negotiation of power either way. So whether they do cover up, they're negotiating power in a certain way. Well, maybe I don't want to, engage in a dialogue with this person or the police officer. So you know what? I'm just going to take my power and do it this way. Whereas the person talking has a particular power also. So it's a negotiation, not linear. Or the person might say, nope, going to use my power. They might not say that, but their actions would be using power, agency to push back and breastfeed in public. And another example, quick example of that was when my first daughter was born, very young, I was breastfeeding. My friend, also, her son was just a month younger. We decided that we were going to go to the Eaton Center in Toronto, where we lived, and we were going to breastfeed in public because we just wanted to push back. So purposefully, we used our agency to do that. So hoping that that shows the complexity, the moving pieces, and how that can all come together for a social justice cause. And that's just breastfeeding. And we can certainly use many other examples. So with power, Foucault writes a lot about power. And power, I think, just in general, the dominant discourse is that power is linear. And many times we think of, power is going to do something to someone. And Foucault says, no, power is not linear. People do not directly have power over you. Institutions never have power over a person. It's how the person reacts and uses their own power. Everyone has power. So the discourses, the example that I gave, your beliefs and your practices, that moves through different discourses because there's different meanings, different stigmas, different judgments, different ways to support and celebrate in discourses. And it just depends on the person and what they choose to believe and buy into. So negotiated, everyone has power. You really need to look at the meaning. And as demonstrated, it might create inclusion and exclusion, depending on how you feel. And to be able to understand power in this way, so Foucault, I see, was very, ahead of the times, and other scholars obviously agreed with him to think we need to address power in a different way. So let's work with the power. Everyone has power. Let us see what's going on. So digging deep, looking at feelings, all of that. So a part of this, and there's a lot of writing about language in postmodern, poststructuralism, certainly in feminism. So the meaning of words can be different to different people. So as I showed with breastfeeding and breast, it will mean different things, and throughout different cultures too. So words are not transparent, they're not neutral, and they're not value-free. I want you to think, and I want to ask you, what do you think of when I say the word beach? I'm going to give you 10 seconds. So just pause, and I want you to think about what were the images, what were the words that came to mind? Now, I can't hear you, but in previous workshops that I've done, people will say, oh, nice and warm, sand, sand castles, rolling waves, lovely and calm, scary because I had a near-death experience of drowning. So you can see right there, even though the beach is often considered a relaxing place, some people might find it as scary. When I bring up the image of a beach, does that change your thoughts at all? Does it change based on what I just told you? So when you look at this, some people have said, oh, it's pretty crowded. And other people might say, ooh, there's not too many people there. So again, relatively speaking, what is that beach? Where is it? Oh, look at the mountains. Just trying to think where that might be in the world. So a dominant way of looking at the beach is often calming. And I say that because when I was a prenatal teacher years ago, I would do a relaxation exercise. And the one that I picked up was think about the beach and the calming waves. So it was a dominant way of thinking about it. And so it might be for the majority of people, but there was a few people, because one of the partners came up to me afterwards and said, that was not calming for me, Megan. That was anxiety provoking, because I did almost have a near-death experience of drowning. And that just brought to my attention that it means different things to different people. So again, looking at multiple truths, multiple ways of looking at the world. So as researchers, when we talk to participants, we need to open that space. That's what qualitative research can do. And feminist poststructuralism is great to use with qualitative research. I do want to just mention this for a moment. Foucault in particular and others talk about binary opposites. And they are socially constructed with embedded assumptions, and power relations hold them in place. So you can see black, white. I meant to put man, woman, gay, straight. And we talk about the binary and how that is very harmful, because if that is the way we are understanding language and some of our beliefs, then it locks us in to a certain way of thinking and doesn't open the spaces. So in order to open those spaces, Foucault would say, look for the problem, look for the tension, and then question it. Question that status quo. So we know historically there is racism based on many things, but certainly the binary is a part of that. What I have been excited to see over the last, well, at least 10 years in a really strong way, that binary is used a lot in the 2S LGBTQ community language, and it's a wonderful teaching moment. So saying non-binary, man, woman, it's a pushback. It's a way to assert power in a particular way. It's a way to change language, change meaning. It's definitely a Foucauldian way of looking at power. So again, question the status quo. Our Western language is built on binaries. So you can see how our culture, our society is so embedded. So very problematic. So deconstruction. So all of those examples that I have given to you will help you as researcher to challenge different meanings and assumptions. Question the everyday status quo. Expose those underlying meanings that are suppressed, they're oppressed. Different discourses, there are the hegemonic ones that we just live with and accept, but we need to find out why. And when we do find the othered, the marginalized discourses, what are we going to do? Bring them to light, learn. And researchers have that opportunity, that privilege to be able to do that. And always recognizing that what we see is a partial representation of reality. It's not everything. I know quantitative research tends to do generalizations. Let's see what most people do. With qualitative, and particularly with post-structuralism and feminism, recognizing this is a piece, but this is a really powerful piece. This is reality, and we can learn and we can transfer those findings even with a small sample. And again, as I just mentioned, looking for those contradictions, the conflicts to begin with. What's the issue? What's the problem? That's where you begin. And then pulling all these concepts into place to help you find out. Subjectivity is a person's position. So you can look at your own subjectivity. I want you to think about yourself, who you are historically and at present. Have things changed? We can think about ourselves as, our skin color, gender, sexuality, race. Are you a student, a teacher? Who are you? So depending on who you are and who you are with, that might change. When I was doing my PhD dissertation, I was interviewing people who were mothers at the time, because my question was, do you feel like a mother? What is it like? And that. And one woman said, you know what? I feel less of a mother when I'm with my sister who has older children. I'm learning from her. But they said to me, as a researcher, I did not have children. they said, I feel more of a mother when I'm talking to you because I feel I'm teaching you and I'm telling you things. So that was really interesting. So your subject position can shift and change depending on where you are and who you are. So subjectivity is important. And then finally, agency, what you do with your beliefs and values. How is it that you are going to negotiate power? And again, can't do power over, but what is it that we do with it? So being active, do you agree? Do you embrace a discourse or do you resist? So there's different ways to use power, and that looking at everyone, no one is a victim. It's socially constructed with that meaning, but it enables us to look at everyone, to say everyone has power and no one is locked into those binary ways of thinking. Okay, so caring for children with intellectual disabilities, challenging the stigma is one of the research projects that I did. So I teamed up with Dr. Lynn Bro from the IWK Children's Hospital, Children and Women's Hospital. And with every good research project, you need to clearly identify the problem, looking at the research, but also from your experience. So Lynn, being a quantitative researcher, knew that there were some difficulties that children had and paired up with me, and I am a qualitative researcher, with feminist poststructuralism. And we decided that it would be a good fit. I assured her it would be. So children with intellectual disabilities have more healthcare experiences than mainstream children. So Lynn was telling me this. She knew this, and it's an issue. And individuals with intellectual disabilities may be treated differently in healthcare settings. And her experience was to see this. So there is that marginalization, there is that stigma. So it's written about. A little bit more from the healthcare point of view. Healthcare professionals, many have negative attitudes regarding intellectual disabilities. And that's often because of feeling discomfort, feeling fearful, not having the experience. Therefore, children are often segregated, and because some might be nonverbal or just communicate differently, it's difficult to communicate with the children, therefore relying heavily on parents to guide and implement care. So we knew this, and it's in the literature, but we really wanted to dig deep. We didn't just want that quantitative information, but if we could go a little deeper, find out what was going on, then we might be able to come up with some solutions on how to deal with it. So our issue was that we believed more information is needed to understand how children, parents, and nurses negotiate relations of power that construct hospital experiences for children with intellectual disabilities. So hospital focused. So therefore, we came up with the purpose in question to explore hospital experiences of children with intellectual disabilities, their parents, and nurses. So we had 3 groups that we wanted to interview and find out about their experiences. Methodology, as we've mentioned, if we could get to the personal experiences, we felt that that would tell us a lot of important information. We wanted to see how they negotiated power, and we wanted to know how the healthcare system as an institutional discourse, as well as the social discourse of intellectual disabilities, how those discourses came together and impacted their experiences. So the data collection, semi-structured interviews individually, 17 nurses, 12 mothers, 8 children with intellectual disabilities. The children had a mental age of 7 years or above as identified by their parents. And then we had transcripts, word for word, that we were then able to analyze. So the findings. So hoping that these findings just start thinking about feminist poststructuralism and how that informed these specific findings. So the language, the meaning and language that the mothers and nurses used. Diagnosis was very important. It was a medical term that enabled access to services. So based on signs and symptoms, and sometimes it would take a couple of years to diagnose an intellectual disability. And so some children were just kind of caught generally in the system. Then there were labels. So yes, they used the term label, and sometimes that meant the diagnosis, but sometimes it meant who their child was, just kind of in general in society. The meaning was shifting. And then there was that medical, but then there was the stereotype. So that was that social construction, beliefs about children and their parents. So just keep that in mind. And I have a couple of quotes that should bring this to life. One mother said, I think having a diagnosis in terms of helping get appropriate teaching techniques in place and stuff was really important. There you go. Another mother said, sometimes labeling, it's a benefit because last time somebody said, what, is this kid stupid? Well, no, he's intellectually challenged. He has a learning disability. So the label would be helpful sometimes just to put it out there for people who don't know and to help others so they don't judge your child and they would feel judged themselves. So the stereotypes, that third part of language, what came out in the narratives that the parents and nurses told us, oftentimes these children were seen as disruptive, difficult, and that they can't communicate. So that it came out because of a comparison. So typically developing children will act in a certain way because of mainstream expectations about children. Children with intellectual disabilities, they are unique and different, and they communicate differently. So unfortunately, it was a negative vibe sometimes. They were seen to be difficult. And the parents, because they had a lot more on their shoulders, a lot more burden, and they were there to advocate for their children fiercely, they were sometimes labeled as bothersome or difficult. So really important. We're looking at those relations of power. We're looking at the discourses to try and understand. So a couple of quotations. I think, first of all, remove that barrier of someone being high need or special need and just realize that everyone's different. So nobody's different. That's from a nurse. I found as soon as I started to talk, it was just like, well, she's a know-it-all. Another nurse said, I'm really careful not to label because the parents feel very guilty. Second finding was relationships are foundational to care. One nurse said, we try to develop relationships, but normally only have about 5 minutes to do it. Mother, I especially find that people sort of talk down to him. So that relational, the emotional part was extremely important. We saw that the institutional discourse of time, nurses not having enough time, and the physical aspect of health, that is a dominant discourse in health. We know that. Saving lives, the physical aspect, that's why you're in the hospital usually. But many people would argue the emotional, mental health is just as important. But we clearly saw there was that hierarchy. There was that relation of power that created different discourses that were prioritized differently. Talking down to, again, that negative vibe at times, but not always. So looking at that relationship, sometimes it was difficult for healthcare professionals to do that because they didn't know. It was the unknown. They were uncomfortable. They were fearful. So they couldn't establish that relationship. They needed learning. And again, as I mentioned, physical care prioritized and it was limited. So these are the difficulties that came out. So on a positive note, how did relationships work? Why did we know they were so important? Because the mother said, one of the mothers, she, the nurse, always has time. Always. She listens and she talks. She's a gift. And the child said, most of the people there are nice and stuff. They were really cool. And all the children spoke very highly of the hospital, probably because the nurses, healthcare professionals, and parents, they just rallied around and to ensure that they did have a positive experience. It was the nurses and the mothers in this case, I forgot to mention, we invited parents and guardians, and different partners, but only mothers. So that was a gender issue that came up. So that was interesting. Who are the caretakers that usually bring children to the hospital to advocate for them? And that was the mothers. So again, who are the caretakers who are being helpful? And a lot of times the relationships were just so important, but often get lost. So looking at the different discourses and how that happens. Information sharing was really important. The charting did not always include details of the children because there's just so much. There's so much to write. What do you do? So needing to be specific. Write down how children express themselves. What are their comfort measures? One mother said, sometimes they'll just say, briefly tell me about Jane and why you're here and what brought you here. So then I'll have to go through the whole thing. I just feel like if we're at the hospital, it should all be in the file. So there's a lot of burden on the parents. The sharing, there was a lack of sharing, and there was a lot of reliance on parents to tell the story over and over again, led to gaps in care. One nurse said, when I see this report, I'm thinking, Mother of God, this would be helpful information to have every time she comes in. We should know this. I put a note on this care plan to read, please read, instead of saying she's developmentally delayed, which really tells you nothing. So how do we get information? How do we share that in a different way? So being creative, and that's what the nurses were doing. Reducing stigma. So in our education system, we don't teach a lot about children with intellectual disabilities. How do we move forward so that people are not uncomfortable? How do we address unintentional stigma? And we need to address continued devaluation of ID education. So those are some suggestions that came out from mothers and nurses. So nurse said, just the comfort level would be so much better if we had some more education surrounding it. We are really reliant on the parents. Another nurse, you learn as you go. I just find it's just exhausting because I've been so involved in her medical care. So addressing the stigma, and that's really important. So in conclusion, mothers and nurses challenged negative stereotypes. Nurses and mothers challenged barriers to building relationships by finding time and creative ways to work with children and parents. And the nurses challenged dominant charting practices with informal tea times and innovative charting. So we can see how mothers and nurses in this study, they were using their agency, figuring out how they can shift that power to make the experience for children and the parents better. So the recommendations, so they come out differently with a feminist post-structural piece of research. So you can see, look at the language that we're using in our recommendations. Healthcare professionals need to understand. So it's fairly open, but how do you gain that understanding? How diagnoses, labels, and stereotypes impact care. Healthcare professionals and parents should work collaboratively to recognize and challenge moments of stigma and stereotypes. Building caring and effective relationships should be given the same priority as physical care tasks. Mood expressions and communication styles need to be formally documented. More education regarding pediatric IDs is needed. Parents need help navigating the system. I invite you to watch one of our videos. It's our knowledge translation 14-minute video that pulls all of these ideas together. And just a conclusion that post-structuralism and feminism were really helpful with this research study. The concepts were able to inform not just our analysis, but our recommendations, how to move forward, making a difference. So this is a social justice issue, we believe, relations of power, equity, diversity in all areas of healthcare. And it's an example of how post-structuralism can be used with other philosophies and ways of knowing. References for you to consider. And I will stop sharing my screen for just one moment. And I would like to thank you for having me here. Hopefully there was enough information for you to get a beginning understanding of feminist post-structuralism. If anybody has questions or would like to reach out to me, I would be absolutely thrilled to talk with you. So good luck with your studies and look forward to meeting with you in the future.